this orthodontics now what I am,
orthodontics,
but I want orthodontics kids to be better, and I know that we can do. You are in the video. I think that team. We all that's what we have part of a team to do that. Go to the next step.
Yeah.
But
if you're just tuning in, I want to welcome everyone here for our live event. This is discussion panel of track 3, orofacial myofunctional therapy and orthodontics. We have assembled here today key panelists who are leaders in their fields around the world. If you're just tuning in, I want to welcome everyone here for our live event, and we're going to hear from many others. Discussion panel of thank you, Dr. Santos. Orofacial myofunctional therapy. Did you want to say something, Mark? We have assembled here today
really quickly,
key panelists who are leaders in their fields around the world.
Doesn't really drown me out.
Is here speaking with us as the moderator.
It's a real honor
and
to
we're
be
going
here
to hear
and to
from
have
many
this track
others.
around myofunctional therapy
so
and
thank you, Dr.
orthodontics.
Santos.
So from the perspective of, I think everyone here,
Mark?
you cannot separate
really
myofunctional
quickly,
therapy and orthodontics.
The buzzsaw from our neighbor's yard
when you
doesn't
look
really
at the
drown me out.
guidance statements or position statements or policy,
it's a real honor
with
to be
major
here
leading
and to have this
orthodontic
track
societies,
around
including the
myofunctional therapy
American
and
Association of Orthodontics. So from the perspective
fundamental
of, I think
pillar
everyone here,
or tenet is
you
missing.
cannot separate myofunctional therapy and orthodontics. In our keynote presentation, when you look at the guidance statements or position statements, a lifetime achievement award with major leading orthodontic societies, including the American Association of Orthodontics, that really fundamental pillar or tenet is missing. And we had Ono as chairman of the World Federation of Orthodontics meeting, a presentation from Dr. Takashi Ono, as department chair at Tokyo Medical Dental University, gets 35 Hippocrates PhDs a year, which is at the same gala we could go really today about changing medicine. The same award to Dr. John Mew, who's on this panel. Takashi Ono is chairman of the World Federation of Orthodontics meeting, kind of considered more on the fringe as the department chair at Tokyo Medical Dental University. Gets 35 to the messages in their presentations. They're talking about the same gala. So I think we're at a really exciting time. The same award, perhaps Dr. John Mew, who's on this panel, and I hope we can discuss that. Kind of considered more on the fringe as we explore of the orthodontic what we think might be wrong, but with really orthodontics to the messages what we might be able to do, they're talking about the same thing. Or so I think we're at a really exciting time, white paper, perhaps a tipping point in orthodontics. We had a discussion earlier today about discuss the need for having a white paper on orthodontics as we explore therapy. What we think might be really wrong, its own separate thing with orthodontics, and what we might be able to do. Challenge all of you panelists today, or perhaps to put into a white paper. Go forward. Now, Marissa and we had a discussion earlier today about perhaps the need for having a white paper on orthodontics with introducing the other panelists as you will, which is really its own separate thing. So I just want to open it up and challenge all of you panelists today. So if you want to go forward, Marissa and Gabor, welcome, and go ahead and carry on with introducing the other panelists.
Hello,
as you
everyone.
will.
Thank you for the opportunity. So just briefly about myself, I'm an orthodontist in Budapest, Hungary, and I've been doing professional work for many years.
Your microphone.
And definitely I agree with Marissa. So so there are two problems. So
Hello, everyone.
Thank you for the opportunity. So just briefly about myself, I'm an orthodontist in Budapest, Hungary, and I've been doing professional work for many years. Still believe that, and definitely I agree with Marissa. So there are basically two problems. Isolated one locally and isolated to the structures. So this is number one position at the moment. We have to define that kind of orthodontics, which is different from the mainstream. So we have to go back, still believe that the problem is isolated subcategories and within the orthodontic specialty. Isolated and problem number locally and isolated to the structures. So this is so we have to make a consensus. So we have to define that kind of orthodontics, which is different from the mainstream. We have to go back. Comprehensive rather than strictly subspecialties. So we have been working together with professional functional therapists and problem numbers. and breathing therapist and ENT and so we have to make a definitely we have to make a kind of standardization of what we do that we have been doing something and what we call it comprehensive. So actually, definitely we have to agree upon names and definitions, and we have to provide something to the orthodontic world to understand what and ENT and sleep. So definitely we have to make a kind of standardization. So this is my problem is that which is the process and what we call it to you. So actually, let's go definitely we have to agree upon names and definitions, and we have to provide something to the orthodontic world to understand why is it different. Please introduce yourself. So these are my problems. This is my problem is that I would like to introduce to you. So let's go on with the people. Yes, Thierry. Yes, names. So Dr. Thierry, please introduce yourself and then please introduce how you see the problem.
Make a comment quickly. Yeah. But when I press share screen,
we start. You say a name. We start with Mike.
Yes, Thierry. Yes,
yeah, I can help with that.
All right. So John, just go ahead, please. So now we have some problems. Curious. So John, please introduce how you see the problem.
But when I press share screen, it says that I'm barred by the host.
Mike, I can. Maybe it's best if we start with you. Mike, mute.
All right. So John, just go ahead, please. So now we have some problems. Curious. So John, please introduce how you see the problem.
A great forgotten acknowledgement that within dentistry, way beyond all
maybe it's best if we start with you.
Dentistry,
Mike, mute.
Know that the teeth,
go ahead, Mike.
Alveolus, all right, the periodontum, and the supporting structure, great forgotten for the teeth. Acknowledgement sit in a balance that within dentistry, again, way beyond orthodontics. Within the whole of the inside, the lips and the cheeks on the outside, the teeth. I mean, this is widely alveolus acknowledged. The periodontum and the supporting structures. We seem to be spending so much time sit in a aligning teeth between the soft tissues, and yet so little time inside, trying to change the outside. I mean, this is wide behavior. So with the posture and the function, and yet of these soft tissues, we seem to be spending so much time. This just aligning teeth very, very strange, and yet to me. So little time. You know, I think I could pick up textbooks on orthodontics of behavior and few of them with the posture and the function myofunctional therapy soft tissues at all. Now, this just seems very, without knowing this is a very, very important adjunct. You know, I think I could pick up we could say on orthodontics and few adjunct to myofunctional therapy. Myofunctional therapy at, but all. The biggest, and yet we know the most important without know that this is a very, very important that I see adjunct. In fact, is that maybe we could say that orthodontics is an adjunct to myofunctional who wear retainers at night after their orthodontic therapy. The biggest now, and possibly the most important what are those retainers doing right now? Well, those retainers that I see holding the teeth in position is that they're hundreds of thousands of people. That. Probably millions. If they didn't wear the retainers at the night, teeth would move their orthodontic position. Now, with the teeth, when we ask what are those retainers doing, well, those retainers are holding the teeth in position. Think about that. If they didn't wear the retainer, John Miovius, can you stop screening your would move out of position? Sharing your screen. Well, if the teeth would move out of position. That means okay.
Go ahead, Mike. I'm pinning
you. Sorry. We've got lots of people wearing the retainers, and that was John Miovius. Can you stop screening your at holding the position of the teeth? Sharing your screen? It's excellent at holding the position of the teeth, but it can't hold the position of the soft tissue.
Go ahead, Mike. I'm pinning you.
So it can't hold the position of the supporting structures. We've got lots of people wearing effectively holding the retainer out of their balance. Is very good at holding the position. Quite a few countries have recently acknowledged the need for long-term retention, or rather the instability of the soft of orthodontic results. So and of course, if you have this instability of orthodontic results, so people are effectively recommending long-term retention zone. And I think this is a shame. We shouldn't be recommending long-term recently. We should consider the need for long-term retention, or rather the instability people's soft tissue balance results. This is, and of course, if you have this instability of orthodontic soft tissue balances, people are asking in the long-term retention, holding teeth out of the balance zones. We shouldn't be recommending long-term retention. We should be considering and how we need to resort to myofunctional therapy, soft tissue balance, and we need to make myofunctional therapy as ubiquitous as permanent retainers, soft tissue balances. We're storing up in the long term just for people holding teeth out of the balance zone. People treated without myofunctional therapy, a long-term problem for the future, and for that we need to resort to myofunctional therapy. And we need to make myofunctional therapy as ubiquitous as permanent retainers. Or
we are the ones that change structure,
just for people who are treated, even people who are treated without myofunctional therapy, a long-term problem for the future.
We know that. I think that we have, and we know that retention is because we know that don't achieve. We know that, but how we are the ones that change structure? But the most important thing is posture, creating something that we all work together. We know that. I think that we have, and we know that retention is because they don't achieve the posture. But how can we? Because we know that put this together, all of us. But I think that creating all of us know that we all have to work together and say, well, what can we do? I don't think what happened.
Yeah.
Because we know that my function is more important than our treatment. Because we know that what you said.
Well, okay, what we do about it, well, we can start to spread the message that this exists. Most people are not even aware that this is existing.
Because we know that my function is more important than
something I've been trying to do. And with this conference, I mean, the specific what we do about it, where we can start to spread the message. How can we prevent these problems? Most people are not even aware that this is existing. How can we talk to? I mean, groups, you need to spread the message by telling people something I've been trying to do. All the professionals involved. And with this conference, I mean, the first 1,000 years angle of a child's life, the first 1,000 days of a child's life. How can we prevent and tell them to make them aware that these possibilities, parent groups, even we can talk to all the professionals involved.
Definitely, yes. So let's the first give opportunity to the others as well to introduce their ideas, and then we can get back to the solutions
and tell them to make them aware.
Let's go further.
That these possibilities,
Patrice, can you please introduce your position about that?
Yes.
Definitely, yes. So let's give opportunity to the others as well to introduce their ideas, and then we can get back to the solutions, so the consensus. So let's go further. Patrice, can you please introduce your position about that?
The function, the beauty is all together. But I think one. I think we as a notice that. I think it will tool at the to have balance. But when between the nuts, you never need to do construction. The beauty is all together. It's like, but I say, it's like one. I agree with you. As a novice, the tone I send needs the function to do the treatment.
Just 1 second, Patrice. We need to correct your sound. It's off. So can you sign up? Come back in. We'll come right back to you. And I would like. Could we have? Sabina Sacamano, please say a few words. Just 1 second, Patrice.
Dr. Sacamano,
we need to correct your sound.
She's author of some really exciting work
come back in. We'll come right back to you.
Down syndrome, myofunctional therapy and orthodontics.
I would like,
and she's co-editor of a great new
Sabina
textbook
Sacamano.
with Licia Cocciani-Pasquet,
say a few
which
words.
Came out of an orthodontic textbook. Dr. Sacamano, New Trends in Myofunctional Therapy, which maybe author of some really exciting modern textbook on myofunctional myofunctional therapy and Down syndrome, myofunctional therapy and orthodontics. Thank you, Dr. Sakamano, for your work. Co-editor of a great new textbook.
Actually, if you don't mind, this is Licia.
Which came out of an
Sabina
orthodontic
asked me
textbook,
to
new trends
help
in
her out
myofunctional
because
therapy, which maybe
she's not very comfortable in speaking in English.
myofunctional
So
therapy in English.
she allowed me to speak not only for herself but also for the entire
Actually,
Italian
if you don't
team.
mind, this is Licia.
And Sabina asked me
as you might
help her out because
you might know,
Sabina
she's
is
not very comfortable
and I'm
speaking
a
in
speech
English.
pathologist and
She
allowed me to speak not only for
found the
herself
perfect
but
combination
also for the entire
as I said in
Italian
my
team.
note over here,
And
we are dealing with two
as you might
faces of the same coin.
you might know,
And
we
Sabina
feel that
is
we are
an
both
orthodontist and I'm a speech
indispensable,
pathologist,
but
and
where we
my
should really
functional
focus
therapist.
our attention
And
at this
we
point
found the
is,
perfect combination
trying
because,
to
as I said in my
educate
note
people
over
about
here,
the,
we are dealing
prevention,
with
starting
two
very
faces
early
of the
and,
same coin,
and
using
we feel that we are both
normal function
indispensable,
as a
but
preventative
where we
measure,
should
so
really
that
focus
people
our attention
eventually
at this
don't
point
need us. We
is
want to
trying
work
to
ourselves
educate
to
people about
extinction, in a
the
sense.
prevention,
So,
starting very early,
and
also
the
using,
presentation that
normal
the two
presentations
presentations
that
as a
she
preventative
organized
measure,
with
so
the
that
people
team at
eventually
L'Aquila
don't need
University
us.
in
We
Italy
want to
work
take into
ourselves
account
to
this new
extinction, in a
development,
sense.
which
And
is
so
the use of telemedicine
and
or
also,
telepractice. The presentation
can be actually
very important even for orthodontists to keep in touch with patients more often,
L'Aquila University
to motivate
in Italy,
them, not just
take
to
into account
this
whatever
new
they need in the
development, which is
orthodontic
the
arena,
use of
but especially
when along with an orthodontic treatment,
can
you
be
have
actually
at the same
very
time
important
before,
even
after,
for orthodontists to
a
keep in touch with
myofunctional
patients
treatment
more often,
and or
to
a
motivate
breathing
them,
treatment,
not just
because
to
we have to look at the
whatever they need in the
orthodontic arena, but especially when
of function.
along
So
with an
breathing
orthodontic
comes
treatment
first.
you have,
And so
at the same time
telemedicine
before, after,
has
etc.,
been really
a myofunctional treatment
great
and
adjunct
or
to
a
what we are trying to do,
treatment,
and
because we
probably
have
in the
to
future
look at
it will
the,
allow us to reach a much larger pool of
importance of functions,
but
so
also
breathing comes first.
patients,
And so
telemedicine
so that we
has
can
been
educate
really
them on the importance of
great
working
adjunct to
together,
what
so
we
that
are
they
trying
don't
to
think
do.
about, well, I'm
And
going to go to
probably
the
in the
dentist,
future
it's
it
only
will
gonna
allow
straight
us to
teeth,
reach a much
straighten
larger
teeth, and
pool
that's it.
of
And some people just
professionals,
go
but
with
also
wild eyes
patients,
when orthodontists talk about myofunctional
so
therapy,
that we can educate
and vice
them
versa on the importance
So
of
that's,
working together, so that they don't think about, well, I'm going to go to the dentist, is only going to straighten teeth, and that's it. And some people just go with wild eyes when orthodontists talk about myofunctional therapy
Antonio
and vice
Stecco
versa.
is not on this track.
So that's
I don't know.
that was the
Miho
core
back?
of her presentations, plural.
Miho Imamura, are you there?
Mio, now
Yes,
we can have Antonio. Are you there? Stecco?
Okay. Antonio Stecco is not on this track. Pasquet is president, founding president of our society. Miho Imamura, are you there? And a colleague. And it's exciting to have her here, kind of helping build bridges between the great work that's been done in Italy, Licia Cosciani Pasquet. We had our first scientific meeting in Italy 6 years ago, of our society. We had our third Congress in Italy, a colleague, 2 years ago. It's exciting to have her here, kind of helping build bridges, finding ways to build bridges around the great work that's been done in Italy is really part of our work. We had our first scientific meeting in Italy 6 years ago. Maybe we lost Miho, but Kevin Boyd is back. Third Congress in Italy just 2 years ago.
It's not there.
Really finding ways to build bridges around the world in order to advance this is really part of our work.
Yeah, hi, Marissa.
Hi.
I don't know if maybe we lost
Yeah,
Miho,
so I'm sorry,
Kevin Boyd
I
is
was
back
downstairs and I think I'm finished up, so I can stay now.
It's not
Where
there.
did we leave off? I'm sorry, Mike New was talking when I left, and sorry I missed what he had to say.
Kevin.
Really,
Yeah, hi,
what you need to do is each of the panelists is framing what they see
Yeah,
as the
so I'm sorry,
problem with
I was
orthodontics
downstairs and I
as
think
it
I
exists
finished
today,
up, so
and what
I
are
can stay now.
possible solutions
Where did we leave off?
for
I'm sorry.
that, and what could
Mike
go
Mew was
into a
talking when I
possible white
left, and
paper on
sorry,
the
I missed what
subject.
he had to say.
So there's a
So,
push for
yeah,
really white what paper you on need to myofunctional do therapy and is orthodontics. each of the
I
panelists
really
is
like
framing
what Mike
what they
said
see as the problem with
orthodontics, at least,
orthodontics as it
in early
exists today,
childhood,
and what are
should
possible solutions
be seen as an
for
adjunctive to
that, and
myofunctional
what could
therapy.
go into a possible white
That
paper on
was
the subject.
like
So
revolutionary,
there's a
Mike.
push for creating white paper
And
on
I really,
myofunctional therapy and
it
orthodontics.
sums it up. I really like what Mike said. Myofunctional disorders, orthodontics, at least underlie all in early childhood etiology of malocclusion and non-syndromic children. An adjunctive to myofunctional because therapy. Of myodysfunction. So that was, I think that could be a goal for a white paper is how we shift and the thinking. I really, and Mike sums it up, is that myofunctional disorders, I just like, they underlie all, that's really all I want to say, etiology of malocclusion and non-syndromic children. They're all because of myodysfunction. So well, I think that could be a goal for a white paper is how we shift the thinking. And Mike, that is like awesome. I just like, that's really all I want to say.
Where are you? Yes.
Since Patrice had stepped off, why don't we go back to Patrice because I think his sound is better now.
Yeah.
Okay.
It's only, you need, when you not
where are you?
You never need to witness the place or the
Since Patrice had stepped off, why don't we go back to Patrice because I think his sound is better now.
Yeah.
Okay. Wait, Patrice, we are not able to hear you.
You need, when you not you never need. So I go back with my face or the tone of I can't. They will
Mio, are you there?
Limit the extraction. Find a way.
Wait, Patrice, we are not able to hear you.
So one of the things that I think is important to note that the term myofunctional therapy, even though it maybe existed in different formats, was actually, it's credited with having been coined by one of the fathers of the field of orthodontics, that I think Alfred Paul Rogers, important to note, who at Harvard's orthodontic program gave a presentation, the term myofunctional therapy, Angle Society, even though in 1918 it maybe existed, really introducing myofunctional therapy, and he spent the better part of his career, it's credited really with having been coined by one of the fathers to say of the field of orthodontics. Soft tissue is always going to trump Rogers. And at Harvard's orthodontic program gave a presentation part to the Angle Society in 1918, really introducing myofunctional therapy. And he spent the better part of his career orthodontics really kind of fighting, as we all know, maybe more in the production line soft tissue is always inspired by even like Henry Ford in the 1920s. Tongue posture was a critical orthodontics. There's a great strong movement, not just oral health, the systemic health. Occlusion, malocclusion, development of the craniofacial morphology, different directions as it relates to maybe more health. In a production line model. So I think this is a really exciting like Henry Ford in the 1920s. Definitely warrants I think exploration. Orthodontics, there's a great strong movement to consider,
Let's give her the opportunity
occlusion, malocclusion, development of the craniofacial morphology as it relates to overall health.
Number one.
So I think this is a really exciting topic and something that definitely warrants exploration.
Categories within the orthodontic specialty. Miho is back, so let's give her the opportunity, and then we can get back to this topic because it is very important. So you have made two important statements. Number one, so Miho is there is a movement in the orthodontic specialty, so we have to divide different categories within the orthodontic specialty, and we have to talk about the systematic health impacts of the.
I'd like to acknowledge Dr. Imamura.
What we have been doing together with
she's one of the founders of the Japanese Society
Miho,
for
myofunctional
therapy,
the microphone?
and she was on the second board of the AAMS, and she's.
I'm afraid her video is not working.
Someone who's been very ambitious about building bridges around the world between disciplines Dr. Imamura specialties. She's one of the founders of the Japanese Society for myofunctional therapy, and she was on the second board of the AAMS. I think you came back online. Someone who's been very ambitious about building bridges around the world between disciplines and between specialties. Certainly, please, Dr. John Mew, helping share knowledge of myofunctional therapy around the world.
In my mind, The main problem is the orthodontic training,
I think
which
you came back
concentrates
online.
on straight
Corinne, are you there?
And very few orthodontists are taught about orthodontics.
Certainly, please, Dr. John Mew.
Posture and the influence. In my mind, posture, the main problem is the orthodontic training, which concentrates on straight listening, and very few orthodontists are taught about orthodontics, or shall I say, is based on posture and the influence of alignment of posture. And inevitably, most make a difference will not even consider its livelihoods to state from providing treatments from people's teeth training, and they are not really interested in alignment. And another factor which inevitably patients make a difference is find their appearance more important than from providing treatment to straighten people's teeth.
Thank you very much.
Really
Dr. Thierry, would you like to weigh in with your panel contribution?
More important
yes.
That's all I'll say. Thank you.
So, thank you very much. Your sound. Do you have Dr. Thierry? We don't have your sound anymore. Weigh in with your panel contribution? Dr. Thierry
yes.
is an orthodontist in the Côte d'Azur. So, and I'm really glad to have her as a colleague in a research project we have going with INSERM, the National Institute of Health in France, that we're doing with her practice and another practice, my orthodontist in Paris, the Côte d'Azur. And so I'm perhaps really glad to have her as a colleague in a research project we have panel with INSERM, as we have a few more minutes of health in France. Are there any comments or questions her practice and another practice?
I don't know if you hear me now.
Yes, we can hear Paris.
Okay, I think, if you are an orthodontist and you want to go to the way of myofunctional therapy, you need always to think to, when you do your treatment, never to reduce the place of the tongue of the airway. It's like, I don't know if you hear me. To limit the extraction or the retraction of the I think, if you are an orthodontist and you want to go to the way of myofunctional therapy, is to find always to think to, when you do your treatment, never and in this way, the best way place of the tongue of the airway. It's like, you need to limit the extraction or the retraction of the arch. And because one of the big problems for the people who do an orthodontic treatment is to find the place really a way to place the teeth, and in this way, the best way is with the limit,
and
to the best way to do expansion,
that's fantastic. Thank you.
To limit the extraction,
it's a dream
and really
for us to be able to say this on this panel,
not to reduce the
but
place
in order to get
for the airway.
Really,
it's really a way we need to
focused, position papers and standards of care with national societies, and we have a lot of work to do, which leads me to a comment. I mean, it's a dream for us to be able to say this on this panel. Mentioned that, but in order to say that what we need to really focus on, one of the things focus is that to create a network of colleagues of care and show our national societies. We have a lot of work to do. I'm really glad to have her as a research collaborator. I just was texted from Dr. Thierry. Maybe a little bit premature. She mentioned that, she wanted to say that what we need to focus on, one of the things, is that to create a network of colleagues and show our results on patients. We work in an institute, and so Academy of I'm really glad to have her as a research collaborator. And I'm excited to say this may be a little bit premature of the government of France. In my day job, separate from the really society, excited about a research consortium we're developing, and having a red cap research database. The Academy of Oral-Facial having tools and resources for orthodontists to collect data, so to have standardized ways for you to share objective measurements, and really excited about to give data. A research consortium we're developing. We look forward to getting that and having actually a RedCap research database. Looking at server space this past week. We envision having tools and resources for orthodontists. They collect data so to have standardized ways for you to share objective measurements and also for patients to give data. So we look forward to getting that. And actually, I've been looking at server space this past week.
In the American Congress of Orthodontics.
Thank you very much, Corinne, for your comments.
That treating early is 7 years old. For me, 7 years old is someone that is because last very time I went with ancient man. So we have to put American Congress. So I said, if all the papers show that treating early is 7 years old is. For me, 7 years old is someone that is the kids know how to chew, to make the exercise, the respiration. So why we are treating at 7? We have to put then. That's what I said. That the American Association says that behind not is saying one, please girls, I was there with Sandra. The kids know how to treat early, and there was a make the exercise, the respiration early. Why we are treating make a consultation at the age of 7? That's a problem that the American Association says. That's why we go. We have to go to pediatricians saying because it's there. They have to know. Please treat early, and there was a panel saying at the age treat of early, make a consultation at the age of 7, at the age of 3, 4, 5. That's a problem, not at the age of 7. That's why we go. We have to go to pediatricians. But the case is, what can we do? It's there to change this. They have to know because we all know that this we know each other, and that we have to start at the age of our next step. How can we reach pediatricians at the age of 3, 4, 5? Not at the age of 7. No. So
that is a very, very good question.
What can we do
I know
to change this?
There are some pediatricians in our community, and they all talk about the training of pediatricians is to really look at research with randomized controlled trials, and that's what they gauge. That is a very, very good question. I think that's part of the challenge here is not there are some pediatricians in our community, and they all talk about that community to say, oh, this is without doubt what we really look at. I recommend. However, if they understand the preventative trials, and that's what they gauge their recommendations on, I'm sure, and I think that part of they will understand the developmental impact that we have on the research for that community. I feel like we have to bring them in. Without doubt, bring them in what we would do and what I recommend. And however, if they understand the preventative aspect in this arena, I'm sure that they will understand the developmental impact.
I would strongly encourage everyone to see Takashi Ono's
I feel like we
keynote
have to bring them in.
because
we have to bring them in a concerted effort and to
induce
invite
mouth
them
breathing in rats
into this
create
arena.
myofunctional disorders, little baby infants. I think that's a great comment. They got really scientific measurements. I would strongly encourage everyone to see the development of high narrow palate. On retruded mandibles, smaller mandibles, figure out a way larger to induce mouth breathing in rats, tongues that create tongue functional disorders, actually. Little baby infants, motor mapping. They got of really the masseters scientific measurements diminished and disorganized. The development of high narrow palate, of on retruded mandibles, smaller mandibles. Larger brain activity, tongues that create also tongue thrust, diminution of the fungiform papillae, the taste motor mapping. So it's going to change how they choose their food, diminished and disorganized. The saltiness, the fattiness, lack of even GLUT4. Brain activity upside down in its level. Also, maybe there's like diminution of diabetes the fungiform papillae. Early onset diabetes. So it's going to change how they choose their food, things, and the quantity. I can't wait until the saltiness, get the fattiness, a center trained at Tokyo Medical and Dental University, GLUT4 functional therapy being upside down in clinical competency. So maybe there's like a correlation to diabetes with humans. But early onset diabetes. Dr. These are all Mew said things. Talking about early intervention, early as possible. Mike Center trained at Tokyo Medical and Dental University. This is really about myofunctional therapy and international pediatric clinical competency. So we can actually start working with humans in our speaker chat room. talking about where should it start? Should it start at zero? Said, talking about early intervention, early as possible. The first 1,000 days of life. Such a fantastic idea. Boyd has even talked about the formation, formation in the mandible in utero and certain factors which may be in our speaker chat room. Was talking about where should it start? Should it start at zero? Expression of the genes results in a reimagine the first 1,000 days of life and the mandible. Kevin Boyd has even talked about really formation of the mandible in utero. I don't know, Kevin, if you factors which may be impacting that. Early ages is really something you want to spotlight. The expression of the genes that result in a forward-growing maxilla and
so
the
when
mandible
we talk
coming
about
forward.
these topics,
So these are all really important questions to
the
explore.
development of malocclusion
I
can
don't know,
start
Kevin, if
as early as even the utero. So definitely, again,
at early ages
in order
is really
to
something
make
you want to
clear
spotlight.
what we are doing differently from the mainstream of orthodontics.
Okay,
so
just
that
again,
that either
when we talk about these
topics,
topics,
because it is very interesting that the development of malocclusion can start as early as even the utero, and then. So we definitely define what kind of different, in order to make clear what we are doing differently from the mainstream of orthodontics. Concentrating on straightening ways that either we change the entire orthodontic specialty or we create a form of categories I think that are intended to define the structures on what kind of different orthodontics or non-based categories are existing. Certainly there should be an introduction of the first category, which is health, centered, functional cosmetic treatments. I think definitely we have to introduce this kind of form of categories that helps us intended to establish define the structures on. This is the one that structural practicing. This is certainly a type of orthodontics. There should be an introduction of the third category, which is health, connecting function between the whole entire body. I think definitely we have to introduce this kind of form of new category that helps us to establish. But we are responsible for the general. This is the one we have to establish a certain new category. This is certainly within the type of orthodontics in order to make it clear that we are doing something different. Connecting, I think it is crucial to entire body, make it clear that we are talking about new category within the orthodontics. This is not
so Gabor. One of the things that we have begun to work on in conjunction with the American Dental Association and the Academy of Pediatric Dentistry,
make it clear that we are
here,
doing something
the Academy of Pediatric Dentistry was instrumental jointly with the Academy of Pediatric Medicine about 20 years ago. So Gabor, one of the things that clear delineation of work on in conjunction with the American Dental Association and the Academy of Pediatric Dentistry that appears here, before the age of the Academy of Pediatric Dentistry was instrumental. One cavity is jointly with the Academy of Pediatric Medicine. If you're under 6 years 20 years ago, not yet to have a defined and clear delineation of what constitutes if there's more than one caries. And there's some other, it is any tooth decay that appears. We need to do the same thing before the age of 71 months old. Goal one cavity International Early Childhood Caries. If you're under 6 years old, we come up with a clear definition of what is early childhood malocclusion. If there's more than one, any malocclusion, and there's some other that appears before the caveats to that, but we need to do the same thing, and I think this is classified as severe goal of the International Orthodontic Society. Coincides with comorbidity. We come up with a clear definition, and we've already of what gone a long way childhood malocclusion. Steve Carson is a liaison with the American Dental Association. And we're trying to package it for him that he can take it so that we get this clear definition. I think this should coincide with comorbidity will sleep and breathe. Embrace this before the Academy of Pediatric Dentistry and the ADA. What's the matter with that? Steve Carson is a liaison with the American Dental Association, and we're trying to package it for him how he can take it so that we get this clear definition of it. Well, I think this should at least maybe the International Society will embrace this before the Academy of Pediatric Dentistry and the ADA. What's the matter with that? Usually worsen. So I will gladly send everybody that with comorbidity with sleep and breathing disorder. How we have defined this, and they are, and how we qualify retrognathic, because maxillas and or mandibles phenotypes first will appear evident in the primary dentition, maybe even in utero, will always persist beyond. They will persist usually without some sort of intervention, almost always usually coincide at some point related with comorbidity with sleep and breathing disorder. And they are there's retrognathic upper and or maxillas and or mandibles, transverse deficiency appear in both arches almost always together, even in utero, right? They will persist without some sort of intervention. They're usually myofunctionally go away. Related to a class 2, always a class 2. So the other one is vertical, whether it's upper and or lower, usually together, or anterior deficiency in both arches, almost always together. This anterior open bite or deep bite. Major those papers in the U.S. in deep narrow palate say that these don't go away. There's 4 things. Once they do not go away, they cannot go away. The other one is vertical, always are associated vertical deep bite, myofunctional etiology, and sleep and airway comorbidity. Anterior open bite, or again, I'll share these definitions. Those persist. You guys can maybe give us your input. There they are. There's 4 things. Alter these definitions. They cannot make it easier for physicians to understand. They almost always are associated with myofunctional etiology. And what is going on sleep here? And airway comorbidity. What difference does it make if they have again, I'll share these definitions. You guys can maybe give us
off, Kevin,
your input.
but we're coming
maybe
up
we
on
could,
the
alter these definitions.
Yeah. And I just want to say we have some viewers out there that are saying absolutely we are in agreement. Sherry Klein, Dr. Boyd, I would love that information. Ella Banica, good point, Gabor. People are out there listening, supporting these ideas. Yeah. So and I just want to say we have some viewers out there that are saying absolutely we are in agreement. Sherry Klein, Dr. Boyd, I would love that information.
White paper on orthodontics and
good point,
therapy.
Gabor. People are out there listening, supporting these ideas. So our job as we move forward is to distill them and put them into an organized wave. It's format beyond us now. It's already carrying us forward.
Oh, Dios mío, a 4th white paper on orthodontics.
Lice Pasquet, you wanted to say something.
Yes, which is like yes, this relationship between myofunctional therapy and orthodontic therapy should be a section beyond us now.
It's already carrying us forward.
It's like a
Dios mío, a 4th white paper.
This aspect
Lice Pasquet, you wanted to say something.
So as long as this is yes, this relationship between myofunctional therapy and orthodontic therapy should be a section of an overall white
wonderful.
Paper,
we're going to
it's like a jigsaw
this now. If you're out there watching,
this aspect is
we take a break, and then at
so as long as this
hour we start the next track, which will be
it's
breathing,
fine, but there are
function, and dysfunction. So please come back. We have Rosalba Courtney as the moderator for track 4. We're going to conclude this now. If you're out there watching, lineup of panelists, and I want to say thank you to everyone here today. Thank you, Marissa. We start the next all of track, which will be breathing. Everyone who's function and dysfunction. So please, wonderful job. Come back. We have Rosalba Courtney as the moderator for track 4, breathing, function, and dysfunction, with a wonderful lineup of panelists. And I want to say thank you to everyone here today. Thank you, Marissa, and all of your everyone who's here. And wonderful job. We will conclude for now and see you in 15 minutes.
Bye.